Usmle Step 3 flashcards. Initial treatment of ADHD in preschool age group patients. And the answer is initial therapy should be a behavioral therapy. Next. Swelling of distal interphalangeal joint. What is it called? These are Haberden nodules seen in osteoarthritis. B12, vitamin B12 deficiency, subacute combined degeneration. Where is the problem in the spinal cord? There's a problem, there's degeneration of posterior spinal column, and there is also a lateral corticospinal tract disease. And you can see paresis and hyperreflexia in these patients. Dermatitis herpetiformis is seen in gluten-sensitive enteropathy like celiac disease. If a patient presents with headaches, diabetes insipidus, incidence of one or more, deficiency of one or more anterior pituitary hormone, what can be this? This can be a craniopharyngioma where the patient has headache, diabetes mellitus, deficiency of one or more anterior pituitary hormone. What is crude birth rate? Crude birth rate is number of live births upon total population is crude birth rate. What happens to incidence and prevalence if you improve the quality of care? If you improve the quality of care, incidence remains same, prevalence increases. Before starting the stimulant therapy for ADHD, you need to take a cardiac history, physical exam, do a weight, take a baseline weight and take vitals for the patient before giving a stimulant for ADHD. If you see a xanthochromia on lumbar puncture, this is diagnostic of subarachnoid hemorrhage. Bedside swallow evaluation should be done in. It should be done in patients with stroke, acute stroke, before giving them anything by mouth. Drugs that, if given, require to increase the dosage of thyroid medication or thyroid replacement. What are these drugs? These drugs are estrogen, tamoxifen, heroin, methadone, and raloxifene. If you give these drugs, you need to increase the Dosage of thyroid replacement. Similarly, if a hypothyroid patient wants to take an OCP, what do you do? You increase the dose of levothyroxine. Why? Because estrogen in the OCPs increases the thyroid binding globulin and therefore the free T4 decreases, leading to increased demand of thyroid hormone. What are the absolute contraindication of thrombolytics? These are blood pressure over 185 by 110, platelets less than 100,000, glucose less than 50 milligram per deciliter, anticoagulant use with INR of more than 1.7, prothrombin time more than 15 seconds, and increased APTT. History of intracranial hemorrhage, neoplasms, vascular malformations, stroke, headache in past 3 months, recent intracranial or spinal surgery